Hi everyone. I've finished recording the lecture that you're about to watch, and I just wanted to add a few disclaimers, a few comments. At the very end of the video, I mentioned that in previous trainings, I was advised with anybody that had disc problems or back problems to see their doctor or physio, and then I mentioned that I'm glad to find out that that was incorrect. I think that I slightly misworded what I meant. If somebody does have a serious back pain or discogenic or disc bulges, or they should definitely be seen by a health professional. What I actually meant was that we can definitely learn how to manage these students and how to help them with the various techniques, yoga practices that are going to help the body to heal. So I think it's important to add this little disclaimer in, because I got excited and said I'm glad I found out that that was incorrect. So remember to always have a good osteo, physio, chiro to speak to if you're not sure. But I want to ultimately empower you to feel like that you can still take these people under your wing and coach them, whether that's one-to-one or in a small class. So enjoy the video. It's about 20 minutes long, and I will see you soon. Hello Anatomy Geeks, I'm Vix, and tonight we're going to talk about discs. So further to the video that I posted a few weeks ago with Martin, where we really talked about management of back pain and discs, I thought that it would be a good thing to actually do an anatomy class on the spine and the discs. Today it's going to be a short class, mainly focusing on the intervertebral discs. There's so much to know, there's so much to look at, and I'm going to use the software Complete Anatomy to help you to see that 3D image of what our bodies look like under the skin. So I will share the screen now. Okay. And you should see a skeleton now. Let's just zoom out. Okay, so this is obviously an anterior view of part of a skeleton. So we've got just the arms and the head missing, the arms, the hip bones and the legs. So you're looking from the front, you've got the cervical spine at the top, 7 segments. You've got your thoracic spine underneath that, 12 segments, and by segments I just mean bony pieces that articulate or attach to the next one via the disc or the cartilage. And then we have 5 lumbar or lower back segments, and then we have the sacrum and the coccyx. We have 12 ribs on each side, and they will start at T1 and finish at T12. So T1 is thoracic 1 and T12 is thoracic 12. So that's just counting from top to bottom: C, T and L, cervical, thoracic and lumbar. Let's zoom in and have a look at the discs. So enjoy the aspects of this that you understand easily, and don't worry if anything goes too quickly. You can always download the free version of this and have a play yourself, which is what I've been doing for 4 or 5 years now, maybe 6 or 7, because I used to have a different one before this. I highly recommend this one, Complete Anatomy. Okay, so anything that I highlight will come up in green, and I've highlighted the 7th thoracic vertebra now, and I've done that so I can remove it. So everything that you have in your body is still there, other than the 7th thoracic vertebra, and the nerves and the arteries. As you can see, it is just the skeleton and the connective tissue. So everything else is still exactly as it would be if we actually had a look in your body. So I'm going to tilt this person forward. Thank you, Larry. And you're going to be looking now almost at a bird's eye view of the disc. So we're going to go through the anatomy of it today, a little bit about the function, the injuries, and a tiny bit about the management, which we've already discussed in the other video. Okay, so your discs, which are 6 in the cervical, 12 in the thoracic, and 5 in the lumbars, consist of 3 parts. If you're making notes, just write down intervertebral discs, 3 parts. The first part, which I'm going to highlight in green now, connect each vertebra to the disc below. and that is your vertebral end plate. So the end plate is a cartilaginous or made from cartilage plate that connects the vertebra to the disc and also allows diffusion of nutrients into the disc material below. So of course, if you imagine, if we just take a step back for a moment, nutrients are coming in through the end plates and down into the discs. If I hide or remove the end plate, you're going to now see what's underneath, which are the two other parts. The first part is our annulus fibrosus. So this is the outer rings of fibrotic collagen, and the best way to remember which one's which, if you aren't confused about is it the annulus fibrosus or the other one. Fibrosis, fibers in rings, which if I zoom in you can see, too much there, they are actually, if I just unhighlight, you can see that they are rings. So they are cartilaginous, collagen rings, tough rings that are there to be stiff and to resist movement in the spine. That is your annulus fibrosus. In the middle is your nucleus, and a nucleus, anyway, if you've studied biology, you'll know is the center of a cell, and the nucleus pulposus is largely made up of water, so it's like 60 to 86% water, and then just some other proteins in there to give it kind of a jelly consistency. So if I go back over the three parts, each disc has a vertebral end plate, a nucleus pulposus, and the annulus fibrosus. Such a mouthful every time you say it. So the three parts of the disc. In between all of the vertebra apart from C1 and C2. That is the first two at the top of the neck. Now, let's have a look at the function of discs. So you probably already have a good idea of what the function is. As you know, as we've discussed at the beginning, there's a somewhat cushioning and shock absorption. It divides the bones to make it safe for us to actually put weight through the spine. But also, if you look at, again, the way that the two inner parts work, so you've got the jelly-like bit and the fibrous bit, they work almost as an orthostatic pressure, meaning that there's liquid pushing back on the fibers when we move around to create a really nice distribution of force and weight through not only the disc that is receiving it, but it can help then push the weight distribution further up. So it works as a really nice team, and it's designed perfectly in the fact that it's jelly-like in the middle and then fibrotic on the outside to give you weight distribution. It can kind of resist forces such as rotational forces, compressive forces, shearing forces, and then flexion or extension or side bending forces, so movement of the spine. Okay, so I'm just going to zoom back out now, or not. I have to go back through the layers. So let's talk a little bit about what goes wrong, what are the injuries, what are the problems that we get with the discs. So throughout our lifetime, depending on what we've done with our bodies, you know, whether that might be heavy lifting and twisting, or maybe sitting at a desk, two very opposing things, very opposite things to do with your body. Depending on that, you will have different stresses going through these discs, and particularly if you go down towards the lumbar spine, and you probably know from your own research that when we sit or when we even twist and lift, the lumbar vertebra and discs do receive a lot of stress and strain, and every now and again, and it is very common, we may almost sprain a little bit or pull a little bit through the disc. But what mostly happens over time, because it is always a slow process when a disc herniates or bulges, is the nucleus pulposus, that's that jelly-like center, actually weaves its way through the annulus fibrosus, which is orientated, or the way that it sits is in oblique or diagonal layers, giving it quite a lot of strength. And it weaves its way through after we've perhaps weakened the layers of the collagen through sitting or twisting, and then you can end up with a migration of that disc material from the center coming out. And if I turn him around and we zoom in here, you're going to see that little, if I get rid of, I'm just going to get rid of that rib, there we go. There we go. So have a look there. Let's get rid of that ligament as well. Okay, so this disc here, which is the T8, T9, so going towards the lower part of your rib cage. Imagine now that you've kind of lifted, twisted, or something has happened. You've caught something and heavy and twisted at the same time, and perhaps your musculature, which we'll go into another time, hasn't supported the spinal stability in that moment. We could get over time then, weakening of that annulus fibrosus, and then you can have a disc bulge. So disc bulges are the #1 injury, and this happens largely in the younger population, so I think between 20 or 25 and 35 or 40. So that age group, because the disc is still hydrated, it hasn't kind of degenerated yet, you're still young, though that's the age group that can happen to. Another thing that can happen to discs as we get a little bit older, even from the age of sort of 35 and onwards, is you can have what we call degenerative disc. Now this is quite a controversial topic. Some back specialists think that it's overdiagnosed, some don't, and they think that it is just a natural process. But in any case, our bodies over time, as we go through the decades of life, will degenerate a little bit. As you know, you might get some age-related arthritis or degeneration in the joints. And that can actually make the disc shrink a little bit, and it will get thinner over time. And then, as I mentioned in the beginning, if bone gets close to bone and the body picks that up in the area, then it will stimulate more bone growth, and then you end up with something called osteophytes, which are little bony growths. And I've actually got a little tool here to show you. It's so cool. Look at that. That would be a little osteophyte, and that would kind of eventually, on both ends there, would start to happen. So that would be little bits of bone. If you've ever seen a rugby player that had a lot of injuries in the knee, you'll see that they've got a big knee because there's lots of these little dudes in there. Now, what can be quite a shame is if those osteophytes sort of head towards that spinal, that nerve, the exit for the nerves there in that kind of gap here. So sometimes that over time can happen, and people would then experience what most of us understand to be sciatica. So the reason for sciatica, which is an impingement or a pressing on or a chemical stimulation of the nerves going down the legs. This wouldn't happen at this level. This is still the thoracic level, in case you're wondering. This is just an example, but it can actually impinge, or it can actually make that space smaller, sending pain and dysfunction into the course of that nerve, which might come out and go down the leg. So in the older populations, you've got this. In the younger populations, you've got disc bulges, and the disc bulge is quite commonly comes out the back here, posterior laterally. So posterior meaning back, and laterally meaning to the side, and that as well, that can pinch on the nerves. Interesting fact, to clear our screens and our minds for a second. I posted it on the page a while ago, but interestingly, a study was recently done on, I think, 1,000 asymptomatic backs or lumbar spines, meaning no pain, no dysfunction. They were just chosen for the study. And I think in the age group of 35 to 40, it was like 60 or 50 or 60% of us have disc bulges. So what do you take from that? They have disc bulges, but there's absolutely no pain. So what causes pain is the question, and that is the big question, and there isn't a single correct answer or one answer fits all. Pain is a very complex thing. So in terms of back pain, one of the most complex areas to study in pain science is the lower back. The answer is many factors, but not always the disc. So, I feel like this fact helps me and my patients, and hopefully you, to realize that we shouldn't be so afraid of things like disc bulges. We shouldn't be afraid to get people moving with those. We should be afraid if someone has a fracture. We should be afraid if they have a tumor. But we shouldn't be afraid so much of these disc bulges. So that was an interesting fact for you. So I'm going to stop sharing the screen for a moment. And I want to show you one more thing. I'm going to talk to you a little bit about management now. So I'm just on the NICE guidelines. Okay, for anyone that doesn't know the NICE guidelines, nice.org.uk is the National Institute for Healthcare and Health and Care Excellence. This is a resource that I'd say most healthcare practitioners and professionals and anybody who wants to look at it use to get the up-to-date advice on all things medicine, medical, bodies, everything. So I wanted to show you here. So I've gone into the page for low back pain and sciatica in over 16s assessment and management. So this is not only low back pain, this includes sciatica or radicular symptoms or pain in the legs or tingling, pins and needles. That for me is kind of the category that with discs that has gone to the next level in severity as well. So it's actually grouping those together. And the interesting thing here, if we look at this bit here, so above that bit it says self-management, provide people with advice and information tailored to their needs and capabilities to help them self-manage their low back pain with or without sciatica. At all steps of the treatment pathway include information on the nature of back pain and sciatica and encouragement to continue with normal activities. So that is the national advice for back pain with sciatica or without sciatica. So should we get involved? Yes. 1.2.2, consider a group exercise program, biomechanical, aerobic, mind-body, or a combination of approaches within the NHS for people with a specific episode or flare-up of low back pain with or without sciatica. So ignore the part where it says within the NHS, that's fine. However, what it's saying here is it is safe and effective for your students with a discogenic issue to perhaps do one-to-one yoga with you, and actually then you're going to be helping them heal, which is amazing. What I learned when I went to India and did other courses around the world in the last 8 years is people with disc issues, don't touch them. Go to their physio. Have they seen the doctor? And that is something that I'm so glad that I've learnt is incorrect now. Of course, some people will not enjoy flexing forward if they have a disc problem. Usually when it's a posterior lateral disc bulge, as I showed you before, where it comes out at the back to the side, it will be more painful to go forward. Yes, so I think a general class, a vinyasa class might be a bit difficult, but a one-to-one or a hatha slow therapeutic flow, teaching their nervous system the importance of not avoiding those movements is the absolute most important thing for these people. So I'm going to stop sharing the screen. If you have any questions about anything I've said, I have recorded this 4 times before I got to this copy, which is the one I will publish, because it's hard not to go off on tangents and say too much. So I did a little flashcard. So if you want a copy of the flashcard, or you want any more information, or have any questions about how to manage one of your students, just write to me on here, Victoria Jane, or on this page, and I will be so pleased to help you with that. Thank you so much.